Do you want to labor and give birth without pain medication or an epidural? Let's look at 6 essential strategies. Number 1, you want to be in upright positions in labor as much as possible, like walking or standing, because we know from the research when you're upright, your contractions actually hurt less, but they're more effective. So it's like the best combination. Number 2, you want to learn relaxation and breathing techniques. Did you know that if you're tensed or stressed, that can actually cause your contractions to hurt more? But if you get into a state of relaxation, that decreases your stress and tension, and it also releases endorphins, which are natural painkillers in labor. The other thing that happens is there's more blood flow to the uterus, and that's going to let your contractions be more effective but hurt less. And also that's going to increase more oxygen to the baby, which is always a good thing. And then you also need to learn the breathing techniques. And so most women use the breathing techniques, which are more of a distraction from the contractions, along with the relaxation together and other comfort measures. Number 3, you really need to go to birth classes to learn all these techniques. Also, you need to learn about what to expect in labor and the benefits and risk of different interventions, the different choices that you have, and your labor support person needs to go with you. And by the way, check out my streaming birth classes in the description below. Number 4, did you know if you have a well-prepared labor support person with you, that you can actually have less pain in labor and a decreased risk of C-section? And so having that well-prepared labor support person is so important, and there again, that's why they need to go to classes with you. Number 5, avoid labor induction unless there's truly a medical reason. And that's because we know in the research that contractions from Pitocin actually hurt more than spontaneous labor contractions. And women have told us that for years, but now we have research to back it up. Number 6, avoid continuous electronic fetal monitoring unless there's truly a medical reason. So we know in the research that if you're low risk, it's just as safe to do what's called intermittent auscultation with the Doppler than it is continuous electronic fetal monitoring. And so this is something you can talk to your provider about, because if you're low risk, if we're doing the intermittent auscultation with the Doppler, that's going to allow you more freedom to get up and around compared to the continuous fetal monitoring. However, if you're high risk or you're being induced, then you would need the continuous monitoring. There again, check out my classes. There's a link in the description for my streaming live classes and recorded video classes. Thanks.